In the spring of 2012, the Central Penn Business Group on Health and Live Well Lancaster decided to join forces to create an event focused on improving the health of our community.
Appropriately named the Lancaster Health Summit, this event was designed to bring together the business community, community leaders and resources to tackle challenging health issues and recognize those in our community who have worked hard to improve the health of their workforce through the Well Workplace Awards. Each year since then, our planning committee picks out a topic based on perceived needs. By bringing together thought leaders and resources, it is our goal to have a positive impact on the issues facing our community. It is not just about identifying problems, but it is about what tools and resources are available to us to effect change. Doesn't sound too difficult, right?
In fact, nothing is farther from the truth. The truth is that tackling the topics of health that are impacting our community is a real challenge. Not because we are not interested in changing, but change can be very hard and the mountain steep when it comes to challenges like mental health, substance abuse, dealing with stress, smoking cessation and obesity. Additionally, the impact of initiatives can take years to measure, so even when there has been change, it is not necessarily measurable.
The 2018 Lancaster Health Summit, which will be held May 24th at the Lancaster Convention Center, is focused on creating a culture of health here in Lancaster. Using data from the Center for Opinion Research, we are going to examine health improvements in our community and identify what still needs to be done. The event also will include an address from Susan Dentzer, the President and Chief Executive Officer of the Network for Excellence in Health Innovation, and Will Stewart, representing Manchester, New Hampshire, a Robert Woods Johnson Culture of Health Award-winning community. Additionally, a panel of local experts will speak specifically about plans for improvements in infrastructure, access to services and community resources. The business case for this topic is easy. Compared to similar countries around the world, Americans spend more on health care, yet have poorer health and shorter lives. Statistics show that we spend over $3 billion annually on health care and each year $226 trillion is lost to diminished productivity because of health issues. According to the Robert Woods Johnson Foundation, a culture of health depends on business, government, individuals and organizations working together to build healthier, more equitable communities.
Because social factors have a powerful influence on our well-being, the Foundation also has as its premise that to improve the nation's health, we must engage all sectors to improve population health, well-being and equity.
Annually, the Robert Woods Johnson Foundation recognizes communities that are models for the creation of a culture of health. Award winners have shown strength in each of the following areas that impact health: the built environment, the social and economic environment, and policy and governance.
Even with all the good work that has been done in Lancaster, we know we still have work to do. For the second time in the last couple of years, we have failed to get beyond the second round in the Robert Woods Johnson Foundation Culture of Health Awards selection process. Even though we are not doing what we do to just win awards, the message is that we still need to work harder together to effect change and improve the health of all our residents. In closing, we ask you to join us at this year's summit as we celebrate the successes we have had and establish a path forward for creating a culture of health for everyone. Learn the details of how far we have come and the work yet to be done. Our long-term success will be based on how well we do at engaging all in this challenging process.
Diane Hess is Executive Director of the Central Penn Business Group on Health, an affiliate of the Lancaster Chamber.